Welcome, everyone. So we have an interesting episode. We will talk about electrodes and we will talk about how new electrode technology improves data in long-term HRV and ECG measurements. And we have an expert here from Nahtlos. We have José telling us a little bit about their innovation and technology in electrodes. Welcome, José.
Thank you, Oli, for having me.
Yes, so let's go straight to the topic. So what was the first technical problem you aimed to solve when you started with Nahtlos, with HRV and ECG electrodes?
Okay, so when we started originally in 2020, we wanted to bring this belt to the market. And this belt, it's like a sport belt, like from Polar with electrodes, but it has artificial humidification. So it will always keep the electrodes a little bit wet or humidified so that the signal quality is excellent over time, over several days. So the first problem we wanted to solve was that we have an excellent signal quality up to 7 days, up to 10 days, but at the same time keep the comfort for the patient or for the wearer. That like they have a long-term skin comfort and also that there is a certain breathability so that there is no skin irritations.
Yeah. Sounds great. And maybe how does your electrode system, how does it work differently than the standard gel or hydrogel options? Maybe tell a little bit like how does your electrode, what sets it apart? And you told about the belt, but you also have like electrodes, single electrodes or adhesive. Yeah.
Yeah, right. So from this belt, it was a long journey and then we developed our Electrode, which is a single electrode with a snap button. And this electrode is especially for long term. So up to 10 days, it can hold, people can shower with it, and still the signal quality is according to the gold standard, which in our view, it's the AMBU electrode, a gel electrode. And what is the difference? So here we have a gel electrodes and then you do have a gel in the middle. And this technology is 60, 70 years old. So since 60, 70 years old, medicine has always used gel. And obviously there was a lot of attempts to bring dry electrodes to the market. But the problem with dry electrodes, once they're not humidified or once the patient is not sweaty, they don't work as they should or as the doctors are used to with the wet electrodes. And what we created was an electrode, which is dry, but with a humidification system. So here you have a water reservoir, and when you press on it, it will burst, and then it will release water steam through a semi-permeable membrane to the textile as it's artificial sweating, and always keep the right circumstance that the signal quality is like wet gel or solid gel. And the beauty on the system, it works on partial pressure. That means when the patient is sweating, so the system will not release additional water steam because it realized, okay, behind the semi-permeable membrane, there's like this balance which we have to be being kept, and when it will not release additional water steam. So that's why it holds very long. And we can keep it up on the skin up to 10 days and still have good signal quality.
Yeah. And maybe you can explain. So there's quite a little water like inside. How
Yes.
can it be releasing it so slowly that it lasts like 10 days? Maybe you said that it's a partial
Very good.
pressure, but how does it really work?
So that is a semi-permeable membrane. We know them from the sportswear, for example, from the sport jacket, winter jackets like Gore-Tex, Sympatex, and then there are so many more. So this is semi-permeable membrane, and it basically takes water and releases it. So when on the one side there is more water, it will absorb it and release it as a water steam. And in that case, so currently it's not activated, but once it's activated, there will be a lot of water in the reservoir. We go to the semi-permeable membrane and release it as a water steam to the textile.
Yeah, interesting. And what else? So you have this humidifying technology there. What else is in your electrodes that sets it apart?
So when you think then about what are the consequences for a service provider, medical service provider or a researcher. And so on the one hand, it's this long-term measurement. And beside the signal quality, one big plus is that it keeps, let's say, the skin breathable. So it's not, for example, the Ambu, which is a very good electrode, but then it has a strong isolation of the gel because the gel should not go out, since it's the one important factor that the signal quality is according to the gold standard, obviously. And in our case, the signal quality is acquired through the textile, and we don't need any strong insulation. We just have to look that the textile is close to the skin. And for that, we use a special adhesive, which is up to 14 days. And we always say up to 10 to be very safe. And this adhesive is breathable, and at the same time, our textile too. Like the skin gets enough air through the side, and it's not that it's the whole time isolated and in very humid or aggressive solution, because sometimes some of the gels are quite aggressive since they want to soften the skin or having a good signal quality.
Yeah, interesting. So, and basically you release the humid, which keeps the impedance there, but you can also wear it in the shower. How does it work that it doesn't change the impedance when you shower and it's wet, that it still stays, the impedance stays about the
So
same?
if it change, and it can change the impedance, so it changes by getting better because the circumstance would be more moistened, would be wetter. So if you have more moistened circumstance, impedance will go down. But then the good thing is if it goes up later, it's still stable through the humidification system. So even the water passes or gets in, it's not a problem because it increases signal quality even more. The only problem for electrodes is when they dry out, because then the impedance gets high and the signal, the artifacts, they will increase. They will have much a bigger impact when there is a motion to the electrodes than if the impedance is low.
Yeah. So the humidity staying wet is important there. And what do you use as a conductive layer? What is conducting the electricity from the skin to the measurement surfaces, basically?
And we can use different conductive layers. We could use polymers, we can use textiles, or even maybe a solid gel, which we additionally humidified. But then there is a problem that they get bigger, the solid gels. In that case, we decided for a textile, which is a polyester with silver on top of it. And we choose also the textile based on biocompatibility. Obviously, that it doesn't create any skin irritation, and that it doesn't have any residual, which could be dangerous for the skin. So, and that was also quite a long process to choose the right conductive material.
Yeah. Yeah. And how
As
do
you can
you,
imagine.
yeah, I can imagine you've been working several years developing this. And how do you test things? How do you test the wear comfort? How do you test the signal quality, durability, and so on? What's the process?
So the first process would be testing on ourselves, and we would walk around with a bunch of electrodes, also a bunch of adhesive materials we maybe are testing. And after we decided for a certain product or a certain material combination, we would go and test with other persons from the family, from the friends, or even here in an innovation center. So we would ask people to wear them for several days. And once that or more or less is clear according to our protocols, then we will go out to the hospital. So currently we are running a test with the Hospital of St. Gallen, where we comparing our electrodes with the Ambu electrodes. And then the question is, what is a good signal quality? Because there is no real standard for good signal quality. There is the signal to noise ratio, which is one factor, but then there's also the baseline wandering and so on. But there are no clear standards. So some devices would say we have a good signal to noise ratio, but if you take the data and put it in another software, you would realize that it's not a good signal to noise ratio. And so we had to develop our own standards for defining what is a good signal quality. And we have there on the one hand algorithm, which we can run through the ECG data and to see are they similar like the ideal ECG data? And on the other hand, we also use some visual quality measurements by cardiologists where they look through the signal and they would say like, yeah, would they be able to have a fast and precise diagnostics of the patients?
Yeah, and you mentioned the signal wandering or the baseline wandering. I remember actually now that I have sometimes done measurements with myself and you see that it goes up and down. And do you know what causes it and how does it affect the analysis? Is it like always a problem or can you algorithmically kind
Yeah.
of cope with it?
No, actually the base wandering is nowadays well filtered out through
Yeah.
the algorithm. And something what causes it, and I have to be careful what I say because I'm the business guy, but as I understood, it's the impedance within the body. So when somebody is breathing, the
Yeah.
impedance is changing, and therefore, like the signal which the electrodes is receiving is also changing. And that's why you sometimes see in the ECG signal very well the breathing pattern.
Yeah. Yeah.
Or another use case for that would be when somebody has water in the legs, and you would, let's say, you would choose two electrodes and measure the impedance, and then based on the water in the legs, so the more water, the less the impedance, or maybe the more, the one I have to think through, but there will be a change, and then you could actually tell this person, hey, take the heart medicine because you're getting more and more water in the legs, and you should take your medicine. So this would be another use cases, which is not ECG related.
Yeah, that's interesting because we have this breathing sensor in one of our
Cool.
devices, which
Yeah.
is measuring the chest cavity impedance. So it
Yes.
changes.
Makes
So
sense.
it's probably linking to that. And of course, when you have
Yeah.
it on the chest, the ECG electrode, you also measure kind of the impedance of the chest cavity at the same
Yeah.
time. Yeah, interesting. So basically, for the long-term measurement, the signal quality is one thing, and then not getting irritation is the other thing. So those are basically two things that
Yes.
define it. What
Yes.
causes the irritation usually? Is it the adhesive, or is it the gel, or is it the not
Good question.
breathable? Yeah.
Yeah.
What causes it usually? Yeah.
So it depends on the electrode. For example, the AMBO electrodes, which is a good electrodes in terms of signal quality, they do have this barrier. And this barrier, it's there that the gel doesn't go out, that is not squeezed out during night. But what happens, it cuts into the skin. So for example, when you have it in the lower part and you're sitting and then maybe you have some body fat and then like you're getting in your belly. So the belly kind of pushes to the electrodes and the electrodes cuts into the skin. So that would be a skin irritation, which can be quite awkward with the time. It will start to hurt or to be very itchy. Then some people react very strongly to the gel. So we have a lot of pictures of people who have blisters because of the gel. And then some other people react to the acryl on the adhesive. So, and sometimes there is also adhesive, I think, which is silicone based. But then some people react to that. So it really depends on the materials which are used. And yeah, mostly, in my opinion, I would say like it's on the one hand, this physical factor that it can cut into the skin, then the gel, and then the adhesive. And for the adhesive, there are some tricks. So for example, 3M has a spray, which was originally created for reducing the rashes with newborns.
Hmm.
Wait, are we going? Get it?
Yeah, please.